Um, But I think from a postpartum perspective, maybe reason number 15 why I loved your podcast and why I love Rachel Rubin is she recently published on the genitourinary syndrome of lactation, which basically talks about the hypoestrogenic or the low estrogen state of the vagina postpartum and how that mimics the pathophysiology of women in menopause. And so for a lot of my patients who are breastfeeding, who have high prolactin, who have low estrogen, I'm prescribing them the estrogen cream that I'm prescribing my postmenopausal women to sort of keep the vagina as healthy and sort of moisturized as possible.
Does an episiotomy affect the ability to resume intercourse after pregnancy, or is that usually healed by 6 weeks as well?
The hope is that it's healed, but unfortunately, pain from tearing in general or episiotomies, which are, to be clear, out of fashion in the absence of an emergency. We don't do routine episiotomies. The data is clear against those. But we do see that any sort of tearing or cutting that happens at the vagina can lead to pain, which can lead to dyspareunia, pain with sex, and therefore we have, drive issues and sexual health issues as well. And another thing to think about from a postpartum perspective is how these insults of pain can sort of manifest into something bigger than they are. So initiating, or sort of participating in sex before you're ready and having a painful sexual experience can cause tightening of the pelvic floor, rigidity in the muscles, and can set into motion a pain cycle that then takes, future pelvic floor physical therapy to break that pain cycle.